is at the clinic here for, I guess, today is your last day.
Today's my last day.
Has been helping us with that during the basic course and our senior course. It's instructing the students on warrior toughness, what it is, kind of the science behind it, and giving them some techniques to incorporate those types of things into their daily practice. If you don't know, this is something that's actually happening in boot camp and ROTC and CBL 365, where they're actually using these types of techniques to help our sailors better handle, be more resilient, handle stress better, and those types of things. So we think it's a great thing to offer to our students, and since she's going away, we're going to videotape it and hopefully have it forever for posterity, until we can find, if we can find, someone to replace her or not.
I know, I'm trying.
So with that, I will turn it over to Dr. Joliceur and let her do her thing.
Thank you, sir. I appreciate it. Good morning, everyone. As he said, I'm Lieutenant Commander Megan Joliceur. I am the outgoing Senior Medical Officer here. Today is my last day. I'll be out of the Navy July 1st, start terminal next week. So a lot of changes there. I am a board-certified family medicine physician, also trained in integrative medicine, medical acupuncture. I'm a yoga instructor. And then I also trained at Balboa for mind-body medicine. So this is definitely a big passion of mine. Today we're going to talk about mindfulness, as he said, and meditation. Kind of just expanding on, I know the military is picking up a lot on this. They're calling it the toughness program. Balboa has their own mindfulness type of program. And then even at Camp Pendleton, if you've ever seen the new Intrepid Center, which is beautiful, they do a lot of this work there as well. So our goals today, so we're going to discuss this concept of burnout, something I think we're learning more and more about. We're going to talk about why we need mindfulness to help prevent this or help treat this, kind of define this term mindfulness, explain why it's important, and then of course discuss some of the evidence, and then of course we're going to do some practice exercises as well. All right, so we're going to start with an exercise, repatterning the nervous system. So how many people, when you get upset or you're frustrated or maybe you're just really worked up or someone you say, hey, stop, take a big deep breath. If you think about that, right, we all kind of do. If you think about it on a physiological level, when you take a big deep breath, you expand your diaphragm. When that happens, you activate your vagus nerve. Your vagus nerve is the key to your parasympathetic nervous system. So you have your sympathetic, which says fight or flight, raises your heart rate, says, hey, I need to fight, get away from this tiger. I need to get things going. Your parasympathetic says, hey, it's time to calm down. So when you're taking a big deep breath, you're actually triggering your body to calm down. So this is one of my favorite exercises. This is something that you can do at any point of the day. You can do this while waiting in line at the grocery store. You can do this, for me, maybe in between patients. But we call this the 4-7-8 breathing technique. And the way we do this is we're in a seated, comfortable position. You can be standing, of course. But what you're going to do is inhale through your nose for 4 counts. You hold it for 7 beats, and then you exhale for 8 beats. And you can do this for a few cycles. You can do this several times a day, whatever works for you. So we're actually going to do it together. I'm going to do an example, and then we'll do a few rounds together. So it looks like this. You inhale. Hold, exhale. Okay, if we can all do this together, we'll begin. If you feel good, go at your own pace. I'm not going to count and have you hold your breath at my pace. So begin, inhale, and hold, and exhale. Good, one more. Inhale. Hold, and exhale. Good. Who's feeling calm already? All right, so I like to kick all my presentations off with an example. For me, it just, when I'm going through a presentation, it really sticks in my head a little bit more because you can relate. So this is our patient here. She's a 45-year-old senior chief. She's in recruiting. She works about 80 hours a week. If anyone knows recruiters, know that they have very demanding jobs, a lot of stress there, a lot of responsibilities. She's had 8 deployments before, all of which were combat. Currently, she's having a lot of marital stressors. She feels like she's very irritable at work, very distracted. She has chronic insomnia, now developing chronic low back pain, very scattered, very irritable. How many people have, seen someone like this? Maybe it doesn't even have to be in the military, right? You just see someone kind of slowly spiraling. And so as we go through this presentation, I just want you to kind of think back to her and think how mindfulness might be able to benefit her, and then what techniques you might recommend to her. And then also, that person that you just related to, think about how maybe you can help them as well. All right, how many people in here have had stress? Good, we have stress every day, most of us multiple times a day. If you think about it, stress isn't always a bad thing, right? We define stress as a response of being when facing events, situations, people, objects, perceived as stressful, and then that induces your response, which is essential for survival. If you think about it, going back to the caveman days, stress was essential, right? You're out hunting, you see a tiger about to attack you, you got that stress response, it enabled your sympathetics to kick in, and then you could get away. Stress is not always a bad thing. We think about stress because we tend to ignore the early symptoms of stress, and that's where it starts to head into more chronic symptoms. So the goal here, and we're going to talk about this a little bit more in the next few slides, is to address that stress response. So realizing, hey, it's okay that my sympathetics are kicking in, but I don't want to do that for a long of time because it's going to start leading to chronic issues. So again, bringing this back to a self-exercise, I want you to think about what your stressors are. I want you to think about some of the symptoms you experience when you're stressed. I know for me, I start to get flushed, I start to get really hot. And then think about stuff you like to do to manage your stress. For me, I'm a runner. I'll run forever if I'm stressed. And then think about things that make you feel relaxed on a day-to-day basis. So, most of us, probably have experienced some of these signs. So you can have physical signs, so some people get the tension headaches, they just feel muscle tightness, whether it's in the neck or the back. They get the racing palpitations, their heart is beating out of their chest. Some people turn to substances, so we see the alcohol, the tobacco, drug use. Some people eat more, some people eat less. Some people cry, or they get very anxious, or they just feel like there's no hope left. And then, of course, there's other people that just feel forgetful, they feel like they can't keep things together, and constant worry. So those are your early stress warning symptoms. That's your body saying, whoa, you need to pick up on these things and address what's happening here. Because when you don't do that, stress starts to affect the whole body. So it starts to affect your central nervous system. So your memory starts to go, you start to feel a little bit more impaired, you're constantly in that tight phase, that fight or flight response. Your muscular system, the acute back pain, maybe that tightness you were feeling now starts to become chronic, right? And then all of your autonomic system responses stay up as well. Digestive system, your blood sugar, that sweating, all of it starts to become more chronic. And so we call this the negative stress cycle. So essentially you're exposed to something stressful when you don't really take control of what's going on, or you're continuously exposed to that same stress, then you start to develop beliefs behind it. Your brain starts to rewire. And then every time you're exposed to that stress, you start to develop those symptoms until eventually it's just chronic and you don't even know that it's happening, right? So an example of this is Wednesday you have a lunchtime meeting, and that meeting is very stressful for you. And every time you go through, and every Wednesday you panic going into work. And then it becomes chronic where you're not even at work on Wednesday, but it's panic day, right? That's the negative stress cycle. It's imprinted. Your brain has rewired to make you feel that way. So let's come back to ourselves for a second. And feel free to share if you like, but you can keep this to yourself. Have you ever felt burnt out from your work or your duties? Have you ever worried that work is hardening you emotionally? Have you ever felt that things are piling up so high that you can't overcome them? Are you bothered by emotional problems, suffering anxiety, depression? And then has your physical health ever interfered with your work or even your daily life? I want you to stop if you answered yes to any of those questions. I want you to stop, take a breath, observe what's going on, pause, and then proceed mindfully. All right, we're going to transition here. So we just talked a lot about stress, but we're going to talk a little bit about health. Can anyone define or give an example of what makes someone healthy. Just shout things out. Good, okay. Anybody else?
Mental health.
Sure, perfect. So I love asking this question to my corpsmen because they always, doc, it's diet and exercise, because I always tell my patients, diet and exercise every single visit. And that's true, exercise is huge, mental health is definitely huge, diet is definitely a big part of it as well, but there's actually so many more components to our whole health. There's our emotions and how we process those emotions, how we engage with other people, what our values are, how we take care of ourselves and our insight. It's also our meaning, okay? Has anyone been stationed or been to Japan? Yeah, I love Japan. So they have this word there, it's called ikigai. It's my favorite word in the whole world. It essentially means, what is your drive? What's your purpose? What gets you out of bed every single day? That is a part of your health. That's what keeps people going. And so resiliency is defined about how we can create different things and different coping skills so we can maintain that sense of whole health, so we can stay resilient even in times of stress. And one way of doing that is this concept of mindfulness. So what is mindfulness? If we actually look at the definition, it's a non-evaluative, it's a sustained moment-to-moment awareness of our thoughts, our physical sensations, and our affective states. But what is it really? Mindfulness is a way of being present every single moment, okay? There are so many times that we are on autopilot, right? You get in your car in the morning, you go to work, and you get there and you're like, wow, how did I even get here? Your mind is all over the place, right? Or maybe you eat a meal and you eat it and you're not even paying attention. By the end of it, you go, wow, I wasn't even that hungry. I don't even know what I just ate, right? We've all done that, I think, because our mind is scattered. The mind is meant to be scattered or distracted. But what mindfulness does is it brings us back to the present moment. It makes us more aware of what we're feeling, of what we're thinking, of what's going on around us. So we don't miss those little early stress warnings, and we don't miss those other little things in our day-to-day life. We're more attentive. We're paying more attention to what's going on with our health and with our life and with other people as well. And then this can be very essential to leading to that resiliency as well. And so this is grounded on these 7 core attitudes. So being non-judgmental, like I said, and I'll say this several times, the mind is meant to wander. That's how it's created. So bringing yourself back, being non-judgmental when it does, forgiving yourself and saying, I'm just going to be present here in this moment in time. Being patient, having a beginner's mind, trusting yourself, accepting things and letting go. So why does this matter? So I'm not standing here in front of you guys today saying mindfulness is going to cure cancer or be the next treatment for COVID. But mindfulness certainly does matter. It's a way of living a better life, right? It's a way of being in your life. So it's not necessarily a coping issue or solving all your problems, but it lets us leave this world. So we can, this world that you even imagine it to be, but that you can be present and enjoy everything that's going on around you, or even if it's not enjoyable at that moment, realize it so you can address it. And it gives us a more satisfying experience. We're not worried about the past, which can often lead to depression. We're not worried about the future, which can often lead to anxiety. We're worried about each individual moment. So I know you're looking at me like, we get it, Dr. Joliceur, you're pretty crunchy, and you're very into this stuff, which I am. We want the research, and so I love research, so I have a lot of different studies that we can go through. This is definitely more studied than it used to be. I started doing this, about 7 years ago, but definitely a lot more research that's coming out every single day. They're doing a lot of work at Harvard. If anyone's heard of Deepak Chopra, he has a lot of research studies, and at Balboa, like I said, they're doing a lot of research down there. So a lot of the research is founded on this concept of neuroplasticity. Has anyone heard of this concept before? Yeah. So I'm a physiology and neurobiology major. Neuroplasticity is my ikigai. I just find it absolutely fascinating. So what neuroplasticity says is that the brain never stops evolving, right? So we talked about that negative stress cycle. So whenever you see something, you hear something, you engage with someone, your brain is sending a pathway, it's sending a circuit through, and then your body will respond to that. And so when you're in that negative stress cycle, we talked about how you're exposed to that stress and then eventually becomes chronic because your brain rewires that way. Well, what we know is that we can actually change that. So if you start practicing mindfulness, or even just positive thinking, or meditating, or doing all these exercises we're about to go into more depth into, you can rewire your brain. You can recreate those new circuit patterns, so those become the dominant pathways. You can essentially change your brain just by thinking about it. That's pretty powerful stuff. At least I think it's fascinating. And so here's some examples here. So these are a few random controlled trials done at Massachusetts Medical School. So they did the first studies. They took a group of 16 healthy participants and they put them against 17 controls, and they put them through an 8-week course where they were just doing 30 minutes of dedicated mindfulness practices a day. So that was either meditation, body scans, which we'll talk a little bit more about, yoga, just sitting meditation, breathing exercises. And they actually did MRIs. And when they showed the MRI studies, it showed increasing gray matter in areas of the hippocampus, the cortex, and the cerebellar areas, all areas involved in learning, memory, how they regulated their emotions, and then how they perceived different things and interpreted that. The patients themselves felt like they were more aware, they were observing more, and they were non-judgmental. A few more studies. So in 2012, a meta-analysis, they took 3,500 participants and they put them through mindfulness meditation practices. And these patients, all in self-surveys, said that they felt less anxious, depressed, and pain. But they didn't show anything to affect really their mood, their attention, eating habits, or sleep. In 2014, they did another study, 136 different trials, and they show that meditation was associated with reducing negative emotions and anxiety, and that the impact was the same as doing, or better, of doing therapy. So what we call cognitive behavioral therapy, which is going to your therapist and working with a specialized therapist. So these are things that they were doing on their own that were having the same amount of benefit as sending them to a specialist. Some other studies here, I'm not going to go through a million of them today, although I encourage you to look at some of them. But a lot of different research on immunity. We talked about depression and anxiety a lot. Chronic pain, huge. I see a lot of that. Fibromyalgia. IBS, which is a gut disorder. Low back pain, high blood pressure, sleep issues. And then, of course, the military, the golden ticket, PTSD, right? Always think of PTSD in the military. PTSD, depression, anxiety are about 75% of what I see in my practice. And believe it or not, PTSD, although we relate it to the military, is not dedicated to the military. Believe it or not, majority of people with PTSD have had symptoms before they even joined the military. And so I find these studies, these are two big journals, The Lancet and JAMA. One study showed that the effectiveness and the cost effectiveness of mindfulness was compared to those that were using antidepressants, so medications, and therapy. That is powerful stuff. I can tell you as a physician, it is easy for me to hand over a prescription. Here, take these pills, you should feel better. But don't forget, when you take those pills, your laundry list of side effects could be this long, right? So when I'm giving mindfulness, there's no side effects there. Maybe they have to start over, maybe be a little bit patient with it. But think about that. Think about the cost effectiveness of that. Or sending someone to a therapist where maybe they don't always have access. I mean, you think of our time period right now, me trying to get a patient to therapy is like pulling teeth. We're just really undermanned. Where these are exercises they can do in the comfort of their own home, or they can do them with colleagues, they can do them with family, and it's having the same effect. That's pretty powerful. Or if you think about it on a preventive medicine, which is, my job is family medicine, what if we taught these skills and we ingrained this in people before they even could develop PTSD? They were even exposed to trauma. That's pretty powerful stuff too. So what are some of these interventions? So has anyone heard of Jon Kabat-Zinn? He's a PhD. Yeah, so he's kind of the founding father of mindfulness. He has a lot of great books, a lot of research out there. He's actually one of the first that started this kind of mindfulness-based program. And it was actually in my hometown in Worcester, Massachusetts. He created this 8-week program, and he started teaching people how to learn mindfulness, how to just cultivate this mental ease, practice compassion with other people, how to deal with challenging emotions, how to meditate. and then relating to one's thoughts so they're not feeling really overwhelmed. And then eventually this concept that he created, combined with that cognitive behavioral therapy, which is what I talked about, speaking with a therapist, doing different coping skill workshops, kind of came together. And there was a study in 2011, a meta-analysis, where they showed that it was a 34% reduction in major depression through this concept. So mindfulness, like anything, gets better when we practice it. So you think about the formal exercises. We're going to talk again a little bit more about these. This is your dedicated practice. So doing body scans. Body scans are essentially when you think about dedicated parts of your body. So you'll just focus on your feet, and that's the only thing you think about. And then you'll maybe just focus on your legs, and that's the only thing you'll think about, and then work your way up. So you're paying attuned to what your body is doing. Doing mindful movements like yoga, tai chi, sitting practices, just breathing. But the goal is to transform that formal, dedicated practice to an informal practice. So you're practicing mindfulness at every point of every day. So you're being mindful brushing your teeth. You're being mindful eating dinner. You're being mindful just engaging with other people and having conversations. Your mind is not wandering. And that goal is to go, again, from the formal to the informal. So how do we implement this? So there's a lot of different ways. On your desk, they included a packet with some really good, just basic ways to start doing this. So meditation, of course, is a really great place to start. I included a lot of my favorite apps. There's many more that are out there. I don't think Headspace is on there, and also Calm is a great one as well. I think Headspace is now free. But doing different meditation practices, so whether that's listening to a podcast or even just breathing like we did, the 4-7-8, that's considered a meditation. Journaling, that's time for you, getting your thoughts out on the page. Good sleep hygiene, prayer, all of that is considered different ways of implementing this. Even just seeking out better connections and relationships, having more meaningful communications, and active listening is certainly part of this as well. So a little bit about meditation. We've kind of gone into this, but it's a way to develop these positive states. It's a way of tuning everything else out and being present and changing your concept, changing your brain, that neuroplasticity concept. And this can affect both the physical and your mental health. And we know that it cultivates lasting